3, 2, 1.
I'm Jerry St. Jean. I'm one of the clinical educators for the emergency department with lead for pediatrics. This is our giraffe warmer. It's an overhead warmer for neonates, so newly born babies up to 1 month, 2 months of age. It helps us to keep our infants warm so that when we are doing all sorts of procedures such as starting IVs, just doing assessments, we can do that easily and they don't lose their core temperature, and we help to sustain their thermodynamics. So right here, this is one of our defibrillators. This is if a child had a dysrhythmia or if they need to be cardioverted. So this machine will actually deliver electricity to help revert the rhythm back to a normal rhythm. This is one of our ultrasound machines, and currently we're using this for some research and looking at IV starts. How can we better do IVs with looking at the depth with this machine. This is a ventilator, and what the ventilator is used for is children who are having difficulties breathing, who cannot sustain their airway. We will put a tube down their throat and we will use the ventilator to actually breathe for them until they're able to do that on their own. Over here we have a Bair Hugger. And what the Bair Hugger does is it helps us to be able to put a large blanket that has warm heat coming through it to help warm a child's body up if they're too cold. And then we have our Ranger, which will actually heat up our IV fluids to, again, also help us warm children, especially if they've been, like recently, we've had children who've been out in the cold who are hypothermic. In the back we have syringe pumps, which helps us deliver medications that are crucial for cardiac and respiratory function, as well as our IV pumps. And then over here, this may seem very simple, but this is our spinal board. If they've been in a crash, slammed into the boards in hockey, motor vehicle crash, to protect their spine, we'll put them on a spinal board, bring them in, make sure they're okay before we take them off.
My name's Tiffany, and this is my daughter Charlotte, and she spent 11 months at the Stollery through various birth defects and complications and lots of high-end medical interventions, and then we were in the home care system when she was on a trach and vent. And I honestly believe that if we didn't have the Stollery and the expertise and the doctors that we have here, that she wouldn't be here today, or she would be a completely different kid than she is. So it's great that we have it here.